Hi, everybody. I'm State Representative Jeremy Munson in District 23B. Walking around the farm here after a Health and Human Services Committee meeting where we were talking about long-term care, patients in these facilities getting treatment for COVID. The update was led by Commissioner Jan Malcom, who you all see on the updates with Governor Walz every day. I posed a question to her because I've received some concerns from people that are working on the front line. They're saying that people who test positive for COVID-19 could be denied emergency care.
Thank you, Madam Chair and Commissioner Malcom. Thank you for taking some questions today. My first one is about the safety of both the patients and the workers in long-term care facilities. I learned from speaking to some nurses that there's guidelines within certain facilities, and I'm wondering if they're coming from the Department of Health, that if a patient tests positive for COVID, that they have kind of a DNR on their record, even though they may have a full code on their advanced directives, that CPR, because CPR is considered an aerosol generating procedure, that they're told not to perform CPR on someone who's diagnosed with, who tests positive for COVID. Is that a guideline from MDH, or is that just up to the facilities or the hospitals that are stating this?
Commissioner.
Madam Chair, Representative Munson, I'm certainly unaware of any such policy. I'm looking at my colleagues, and we certainly will follow up and ask about that. But that would surprise me greatly if that was a hospital-driven policy either. But I will have to check and get back to you. I'd be really surprised, but I can't speak with full confidence about that right now.
Right. And Commissioner, my reaction is I would be shocked if the state had such a policy. I just cannot imagine that would be the case. So, and I, like you, I cannot imagine that individual hospitals would have that kind of a policy either.
Now, one of the concerns I have, of course, is just patient consent and informing the families. But another concern I have is that the Minnesota Hospital Association and the Minnesota Medical Association and a bunch of long-term care facilities wrote a letter to the governor asking for a liability protection from lawsuits retroactively to the beginning of this crisis. That together, along with a website I found on the commissioner's website that talks about a group that was put together to go through options just like this one, to talk about what happens during a pandemic. How do you ration care? How do you make those tough decisions? Those things together bring a heightened concern to me that we're actually going down a path that we shouldn't be, and that patients need to be informed of this. So I pose these questions, and I want to share this video with you so that we can interact and determine the best path forward. It's important for me to be transparent with you, and so I want to give you this information as I learn it so we can start to put the pieces together and ask questions together and make sure we come up with a good solution that's going to protect both the residents of the long-term care facility and the workers in the front lines.